Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
CP is basically a continuation of first year's clinical practice, but it's more medicine and interaction based, so you actually get to examine role players in tutorials, and so it's more continuous as you don't have a Christmas exam, and there's this one big exam in the summer, but there's also a GP log which is 10%, and this is you have to do your GP log basically based on the visits you do. And then you have to write a log on it, so that's 10%. Just sets you up as you get to see more of a real life scenario of the things you learn in the tutorials. And it's a bit more medicine based this year, so you get to interact with role players, which are kind of like patients, and it's more examination based. There's also no like Christmas exam, so it's continuation until summer, but this means that like the summer is only 50%, so you're always building up information. You do CA at Christmas. The best thing about CP are the tutorials, so I definitely recommend going. It's probably one of the best places to learn, and because you actually interact, and I'd say 100% commit to practicing and not just kind of sitting at the side and looking at the role player, but actually participating. This all like helps in accumulating the knowledge you'll need throughout the year. So at Christmas is 20%, and then you have your GP log, which is 10%, and then the OSCE is also 35%, and the final is 35% as well.
So a big thing to CP this year is the OSCE exam that you'll have in April. So the OSCE is basically an exam on your ability to, do doctory stuff, do medicine. So there's 3 stations in it, and one of them is always a patient history, and 2 of them will be a physical examination, but you'll always be told the night beforehand by Pat Hen what's going to come up. They're timed like 6-minute stations, and it's always good to practice some of these conditions, because you can often be going through it really slowly and suddenly you're caught and you'll be losing marks. With regards to preparing for them, like the geeky medics are probably the best. Like they really go through it properly, and there's text coming up throughout the video and it shows you what you need to be looking for. Pat Hen is fantastic. He puts all the links up on Blackboard. He gives you ones for McLeod, which are another video series. They're really heavy, but geeky medics are just about the best thing for kind of really getting to the point.